Welcome to Invest Insights. I'm Abby Melone. I'm joined today by Dr. Charles Lockwood, the Senior Vice President of USF Health and Dean of Morsani College of Medicine at the University of South Florida, located in Tampa Bay. He joins us for our discussion on the COVID-19 pandemic. Please don't forget to like this video and subscribe to our channel to watch more insights like this. Charles, you've been working with the state and Governor DeSantis quite a bit over the last number of weeks. And planning for reopening, I assume, has not been easy, considering that Florida is so diverse. Densely populated metro areas, farmland, urban sprawl. What did you need to consider when looking at the reopening of the state?
Well, I mean, just hit on a major theme, which is that it's not one state. It's actually many states. And I think one of the complexities of this problem is that not only do we have kind of the rural urban divide, we actually have a kind of a regional divide. And so the impact of the virus in southeast Florida has been really different than it has been, for example, in northwest Florida. You can almost draw a line starting at kind of the top of Palm Beach County and Manatee County, and the impact of the COVID-19 epidemic below that line has been substantially greater, twice as bad to the south as it has been to the north. So that makes it, from a public policy standpoint, a much harder thing to kind of come to grips with.
One thing that you've spoken about is syndromic surveillance networks. What does that mean for the state of Florida? So
there really are kind of four critical things we need to do to not only continue to mitigate the epidemic, to flatten the curve as everybody talks about, although it's more of a plateau now than a flattened curve, but to actually contain it, to actually reduce the number of cases. And this is going to be critical across the summer to get right, so that when we see a resurgence in the fall, we've really dampened it down and we don't have to go through what we just went through. So those four preconditions start with syndromic surveillance monitoring. And that's a fancy term for identifying hotspots. So we need to be able to identify the neighborhoods that, or businesses that are sources of infection, so we can flood that area with testing and tracing. We'll talk about that in a second. And then get people quarantined that are either infected or have been exposed in a significant way. And that's how you stop an epidemic. So what that syndromic surveillance network is looking at subtle signs. It might be people filling out a survey or social media, or if we can work with the Department of Health, syndromic data that they get from their county health departments or from hospitals. Influenza-like illnesses, cough, fever, chills. So we haven't made the diagnosis yet, but we're suspicious. And then we can flood that area. So number one, you need that. You need to figure out where the epidemic is. Two, testing. The problem we have with this epidemic is this is the first time we've ever tried to deal with an epidemic with what's called nucleic acid or RNA tests. So that tests whether somebody is actively infected and they're spreading the virus and they're infectious. Well, the problem with that is, number one, turns out most people don't have symptoms. So if you're under 40, most likely you're going to be asymptomatic. And it may be as many as 75% of people that have the infection have no symptoms. Now, if you're over 70, you're going to have significant symptoms. But if you're under 30, you might not have any. So we're dealing with a situation where we don't even know who to test. And the second problem that we have is that because of the initial constraints on testing, the CDC recommended only testing symptomatic folks who were at significant risk. They're being hospitalized, they're very vulnerable, they're older and have multiple comorbidities, or they're healthcare providers. And so if you took the 25% of people that are symptomatic, we only tested 15% of that 25%. Right. So we have no idea how common the infection is. So the solution to that is in part doing a lot more tests. Now, the other problem with the test is that even perfectly administered, it is wrong 20% of the time. It's a false negative 20% of the time. So that's another reason why we have to test, test, test. If you can flood areas with testing, you'll get a much better idea of who's infected and be able to contain it. And so ramping up testing, and I know I sound like a broken record because I say this wherever I am, we just simply have to do a lot more testing. And for the state, that means about 150 tests per 100,000 people per day. We probably are there now in Hillsborough. We've really ramped up testing in the last 10 days. So the other part of test and tracing is tracing, making sure we take all those identified cases and we map them, and we identify not only the patients, but the folks they've exposed and get them quarantined. And that stops the spread of the infection. So that's the second precondition is test and trace. The third is getting antibody testing that's validated and that's reliable, that tells us that somebody's immune, because then they don't have to stay home. They don't have to socially distance. They don't have to cover their face. We're not quite there yet, but we're getting very close. We've learned that people develop an immune response, that the immune response, this is data from just today, the immune response is protective against reinfection, that even people that are immune might leak some of that virus, dead virus, out for a while. And that's why you got those reports of recurrent. They weren't recurrences. People were perfectly fine. They just were leaking dead virus and picking it up accidentally. And the last precondition is don't overwhelm your health system. And we're certainly not at risk for that in Florida, and particularly not Hillsborough County.
When you talk about the tests, do we have enough tests right now?
Yes, well, in Hillsborough County, we do. We have the capacity for at least 4,000 tests a day. We don't even need to do that number. But we were, a couple of weeks ago, only doing 500. Now we've pretty much increased that number by about fourfold from our best estimates. So we're pretty close to the magic number for Hillsborough, which is 2,250 tests per day. We're probably there, actually.
That's phenomenal. And you've spoken before that this is not linear. What does that mean? What does the public need to recognize as we are trying to attain a way to go back to what will become the new normal, but back into society and back into the office?
Well, people have, of course, seen all those magic curve flattening things, and it looks like a nice smooth line that will go down. But that's not at all what's happening. We've pushed the amplitude of that curve down, but it's now become a plateau. And it will slowly drop over many months, and then it might come back a little bit in the fall. And unfortunately, people will die during that period, and that's really tragic. And the people that are most vulnerable are folks in nursing homes. So you're going to see bursts of cases and deaths that relate to vulnerable populations suddenly being exposed. And it's why the governor, I think, has taken such pains at really clamping down on all nursing home visitors and making sure that every nursing home is carefully partnered with a hospital that can take care of all those folks. And so you see Baycare and TGH and other hospitals working closely with nursing homes to try to minimize those risks. But our job with this epidemic is to keep that plateau as low as possible until we have medications that can prevent death, or ideally we have a vaccine.
What is your greatest message to the citizens of Florida as we continue on this path to reopening? A couple days in, I feel that in most of my interviews, there's still a lot of confusion. What is your advice?
Well, people have to take responsibility for their own care, right? I mean, ultimately, you're the best provider of your own health care. And so you have to assume that everybody around you is infected. Maybe not your spouse, but everybody around you is infected. And that every surface you touch is potentially contaminated. And so if you exercise social distancing and you wear a face mask and you wash your hands multiple times a day with soap and water, and you use hand sanitizer, you're much less likely to, number one, get infected, but more importantly, to infect somebody else. Because remember, particularly if you're under 40, you got about a 75% chance of not knowing you're infected. So if we all assume everybody else is infected, we will dramatically, not only, again, flatten that curve, but be able to get the cases down to such a low level that we don't have nearly the number of deaths that we have now, and we protect that vulnerable population. We've got to try to protect vulnerable populations. That's really the absolute crucial thing that we have to focus on as a state, as a nation, until we get through this period.
And Dr. Lockwood, if people want to find out more information in the meantime, where would you direct them?
Well, lots of sites. The CDC has an excellent site. You just have to Google coronavirus and CDC, and it's loaded with information. Our own USF Health website has a COVID-19 webpage with lots of information. We were lucky enough to have recruited the head of the Pasteur Institute here. He's been on our faculty for the past year. So he's like the planet's expert on infectious diseases. And he has a blog that he writes that is full of information. So that's Christian Brechot, B-R-E-C-H-O-T. And that can be, I think, really interesting for people to read. And he writes it in a way that is good for kind of a lay audience, not just for physicians.
Well, thank you again. That was Dr. Charles Lockwood from USF Health and Morsani College of Medicine. Don't forget to like this video and subscribe to our channel to watch more videos like this. My name is Abby Melone, and you've been watching Invest Insights.